Hello everyone, my name is Christian Romero and I'm going to be presenting a case of a 68-year-old male African-American patient presenting to the clinic with chief complaint of shortness of breath and legs are getting swollen for the last week. Symptoms are getting progressively worse for the last 2 to 3 days. And aggravating factors are ambulating more than 15 steps, doing any activities of daily living. There's no relieving factors just other than resting and elevating the legs. Patient also reports being unable to lay flats and requiring 2 to 3 pillows to breathe comfortably at night. Patient is recently relocated to the county and is here for establishment of care. Last visit to PCP was about 8 months ago. Labs were drawn at that point, and there was no abnormal findings per the patient. Patient denies any chest pain, any tightness, nausea or vomiting. Past medical history of hypertension, diabetes mellitus type 2, BPH, smoker for 38 years, and he's been smoking half a pack. There's no psych history. Surgeries, he had an appendectomy in 2010. And at that point, he was hospitalized for 2 to 3 days. He is allergic to penicillin. He's currently on 5 medications. So he's taking lisinopril 40 milligrams once a day. Flomax 0.4 milligrams once a day. Corec 3.125 once a day. Aspirin 81 milligrams once a day. Metformin 1,000 milligrams twice a day. Vaccinations are up to date. Flu vaccine was given on December 2019. Pneumococcal vaccine was given 2018. So family histories on the maternal side. So his mother died at the age of 84 from myocardial infarction. She also had a history of hypertension, diabetes mellitus type 2, and asthma. Paternal side, he deceased at age 76 from CVA, from a stroke. He had a history of hypertension, diabetes type 2, COPD, and CAD. As mentioned, social history, half a pack of cigarettes for 30 years, alcohol, 2 to 3 beers almost every other day. He is a widowed patient, has 5 children, lives with 1 daughter, retired field worker in which he worked 40 years. He is currently eating 3 to 4 days of fast food due to daughter working 10 to 12-hour shifts. Drinks 2 cups of coffee, limited exercise, but used to walk about 30 minutes every day in the morning. But since the increase of shortness of breath, patient stopped. On the review of systems, there's no weight changes, any fever or memory changes. Patient only reports occasional cough, dry cough, and the shortness of breath when ambulating or doing any ADLs. Vital signs. So heart rate is 87, blood pressure 138/78, respiration rate 24, pain 0 out of 10, temperature 98.8, SpO2 or oxygen saturation 94% room air, BMI of 31.5. Patient is alert and oriented, signs 4, but sitting at the edge of the examining table with some shortness of breath, unable to fully complete full sentences without any exertion. So upon my examination, patient had a JVD of 12 centimeters, pitting edema +3 to lower extremities extending from knees to feet on both sides, normal S1 and S2 with regular rates, crackles to our lower lobes on both sides. So based on the clinical manifestations of the patient, patient could have CHF due to history of hypertension, not eating healthy diets, patient is having or showing symptoms of edema to lower extremities. Might be that the patient has some sort of pulmonary edema or something going on in the lungs due to the crackles. Another possibility is COPD, since the patient has been smoking for 30 years, half a pack. It's an increase, and also family history of COPD. Could have been exposed since childhood. Other possibility, but unlikely, is pulmonary embolism, since the patient is having a relief of shortness of breath when resting. Another thing is could be any upper respiratory infection, which is very unlikely because the patient is not showing any signs or symptoms of infectious process like fevers. So my initial workup for this patient, I ordered a echo, EKG, baseline labs, so CBC, BNP, CMP, since the patient is establishing care, also the PSA, a lipid panel. So based on those findings, patient is already on ACE inhibitors, beta blockers. I ordered with OK on my preceptor furosemide 40 milligrams for once a day for the first 3 days. Following that, 20 milligrams for the next 4 days. Continue taking the aspirin and home medications. Education was given on heart healthy diets and fluid restriction, and also smoking cessation. Patient is going to be following up in 7 to 10 days to the clinic for echo results. If the echo was abnormal, less than 65%, the patient has some degree of CHF. So I'm going to be referring the patient to see a cardiologist. Thank you.